Why do some doctors recommend water therapy and others feel that it's too much of an infection risk? I would love to swim, but my care team says I should wait several months. Do those sealing bandages actually help? Okay, this brings up an area that I actually like to talk about, and that's wound care. So water therapy, a lot of people like aqua therapy. It's low impact. So from our standpoint, it's actually really good. It can be both aerobic and help with cardiovascular, as well as anaerobic and help with strengthening and movement. It's good for improving range of motion. So there's a lot of benefits to aqua therapy. The issue is, when is it safe to submerge a surgical wound after surgery safely without increased risk of infection? And the answer, in my opinion, is when the wound is closed, when there's no discharge and it's basically healed. And there's a lot of argument on when that process is complete. What I tell my patients is when you're no longer having any discharge and the wound is healed up to the point where you're not having any pain around the wound and there's no redness and there's nothing going on that's concerning, then it's probably okay to submerge yourself for a period of time and participate in aqua therapy. They always try to pin me down on a date. And what I tell them usually is I see them back at around 3 weeks. And if at that point their wound looks good, then I'll let them go back to aqua therapy. And then there's a question of, well, how long can I do aqua therapy? That's the next question. Well, I want to go for an hour. I like to swim for an hour. Or I used to do triathlons. I want to be able to do, a mile in the pool. And I usually tell them use moderation at first. So we try to limit it a little bit at first to 30 minutes or so and see how they do, make sure there's no wound reaction, and then just progress naturally as they start to get it back. And usually what I find is that it takes a few weeks for them to actually build up to that time. So it's not so much of an issue. In terms of the dressing, this is an area where I think we've made some pretty big improvements. So rather than taking a dressing down, not being able to shower for a week or two, and changing it twice a day, we've got these fancy waterproof dressings. And they go on in surgery, and oftentimes they can stay on for up to a week after surgery. And there are a lot of different brands. Aquacell, Mepilex is another brand we've used. Preneo is another brand. I don't think it's the brand that necessarily matters. I think what's more important is that these allow you to get back to your normal activities, I think, a little bit faster. And I would argue showering and bathing and personal hygiene is a reasonable thing to want to do after surgery. So you can do this now with these dressings immediately after surgery. We don't let you submerge. There's no sitting in a hot tub or sitting in a tub, but letting the water on it is fine. And then to that note, when you take it off, which is usually around a week after surgery, there are really two options, and I think it's surgeon specific. Some surgeons will have them put another one on for another week. I usually just tell them if it's not draining to keep it off and keep it dry. And so I think that's the approach that I would take. These are not, to my knowledge, rated for submersion. So just because you have a waterproof dressing doesn't mean that you can jump in the pool and swim a mile a couple days after surgery. That's just not going to happen. So if you feel like you can, more power to you, but I still don't think that that's something that I would advise.